Okay, it's 10 o'clock, so we can go ahead and get started. Good morning. Today, for the record, is December 19th, 2017. The time is now 10 a.m. My name is Mike McKillop. I'm a project analyst with the Healthcare Planning and Certificate of Need Section, Division of Health Service Regulation, Department of Health and Human Services. As you probably all are aware, we are here in Franklin to conduct a public hearing on a non-competitive Certificate of Need application proposal. This is project ID number A11427-17, Angel Medical Center, Inc., Construct a Replacement Hospital in Macon County. The information from the public hearing will be used by the agency as part of its evaluation of the project. A decision will be made by the agency regarding this project no later than the end of March 2018. As I mentioned, agendas are available on the table, but the format of a Certificate of Need public hearing is quite simple, so I'll just describe that for you briefly. The way it's going to work is we'll ask the applicant to come up and make a presentation around 15 minutes about what they propose to do. After the applicant makes their presentation, then we'll ask if there are any members of the public who would like to comment on the proposal. Those folks are asked to limit their comments to around 5 minutes, and we also ask them to sign up on the sign-up sheets on the table so that we have contact information. The proceedings are being recorded, so please, when you do come up, state your name for the record. And if you have written copies of any comments or your presentations, if you can provide those to me after your presentations, that would be great. Following the comment portion, the public comment portion of the public hearing, then the applicant will be given another 5 minutes to respond to any comments that came up or to provide any summary comments regarding this application. So if there are no questions regarding how we're going to proceed, then I'll ask the applicant to make their presentation.
Good morning. My name is Karen Gorby, and I'm the President, Chief Nursing Officer of Angel Medical Center. It is my pleasure to be here today to speak on behalf of our Certificate of Need process for the replacement and relocation of the new facility. Joining me today is Jane Kinsey, Chair of Angel Medical Center Board, Kathy Guyette, Mission's Senior Vice President of Patient Care Services and President of Member Hospitals, as well as David Franklin, who is our President of the Mission Clinics. I would like to also thank members of our hospital board, members of our medical staff, and other community members for coming today and showing their support for this very important project. I would like to also thank the agency for being here. This public forum is an important component of the Certificate of Need process, and I thank each of you for taking time out of your busy schedules to come and support this community project. Upon completion of our Master Strategic Facility Plan in early 2017, we learned that it was really not feasible to renovate the existing structure. Therefore, it was determined that it was in the best interest of this community to construct a new facility, designed to meet the current and future needs of the community for decades to come. This represented not only clinically and financially the best decision. We looked at and explored 3 different options. One was to continue in the facility we're currently in and kind of stay at the status quo, which is expensive and really doesn't give the community the appropriate services and level of care that's necessary. Second was to renovate the current facility. This was also very time-consuming because it would have to be done in phases and was quite expensive. The third option was to construct a new replacement facility on a new site in Macon County. This allowed for us to provide services for the future of the residents of Macon County and was actually a cheaper alternative than renovating the current facility. The challenges with our current facility are many. Number one, the age of that facility. It was built in 1955 and had a significant increase in space in 1974. The current facility does not allow for the new technology that healthcare now demands and is very outdated. Also, the current facility does not meet both state and national guidelines. When you go in our inpatient rooms, they are very, very small. They're 40% less than what's required today. And they don't have a 3-foot rule as far as staff and family members being able to circulate around the patient and take care of them. Also, the building is in poor condition. We have issues with both our mechanical, our plumbing, and our electrical systems. Again, when you look at the space, it's going to be larger than our new facility is, our current space is, but the space isn't where we need it to care for our patients. And you consider that in the emergency room and the number of behavioral health patients we now have, the current design does not allow us to be available to watch those patients continuously. Construction of a replacement facility was also determined to be the most cost-effective and really to meet the long-term needs of this community. It has a lower expense than actually renovating the facility. The cost of the new facility is approximately $46 million, and it would have been at least $52 million to renovate the existing facility. It really does not allow for energy effectiveness, and so a new facility will be able to provide systems that will allow us to operate in a more energy efficient manner and therefore lower the cost of our operating expenses. It also will give us the opportunity to enhance our patient experience. Right now, it's very difficult for our patients' families to spend time with their loved one while they're in the hospital. So the new facility will give us that recommended space so we can actually practice patient family-centered care. It also provides access to our community. So it'll be easy for both our patients and for EMS to access the proposed site, and will also provide us with enough land that we can expand as services are needed throughout the community and the continuum of our health care. And lastly, it really won't increase the cost of care in Macon County. When you consider that it'll be a smaller footprint, more efficient, it will actually help with our operating expenses of Angel Medical Center. Collectively, we felt strongly we needed to be in Franklin and in Macon County to ensure that we can continue to care for our residents and their health care needs in the future. By building this new facility on the proposed site, it will increase visibility and access to care. It will also help us to maintain our critical access status and provide for future opportunity of growth as new services are required when you look at the continuum of healthcare communities. We also wanted to make sure that we maximize the efficiency and made sure that we built a facility that could be a low-cost operating system. I'm really excited about the opportunity to present at the Certificate of Need, and I'm so excited too about the possibility of the future of healthcare in Macon County. Thank you.
Good morning. My name is Jane Kimsey, and I'm chair of the Angel Medical Center Board of Directors, and I am a multi-generational Macon County community member. I appreciate the opportunity to be here today to share my support for the Certificate of Need application to replace and relocate our hospital facility here in Franklin. Angel Medical Center is vitally important as the leading healthcare provider for Macon County and its surrounding communities, and for our role in meeting the healthcare needs of our community members. This proposed replacement hospital will ensure that our community continues to have access to high quality, easily accessible, and safe medical care well into the future. 82% of our Angel Medical Center patients are our very own Macon County residents. Of significance, our Macon County community is aging, with more than 28% of our residents age 65 and older. We are home to a much older population as compared to the overall state percentage, which is just under 16%. It is essential that we meet the needs of our aging population when determining the services that will be needed over the next several decades, and to plan for the sustained acute care for those who will have the greatest need, as well as for our overall patient population. Ensuring that our most vulnerable community members have access to acute medical care is not only essential, it is our mission. Angel Medical Center's planned replacement facility will be designed to ensure accessibility and will continue to have a policy to provide all services to all patients, including the medically underserved. The new replacement hospital represents Mission Health, Angel Medical Centers, and the Angel Medical Center's Board of Directors' long-term commitment to critical healthcare services here in Macon County, and to ensuring that essential emergency services are available and are easily accessible. Thank you.
Good morning. My name is Kathy Guyette. I'm the Senior Vice President of Patient Care Services and President of our regional member hospitals at Mission Health. And it's a privilege to be here as a representative of the Health Systems Executive Team. Angel Medical Center is proposing to construct a replacement hospital near the intersections of U.S. Highway 23441 and Honeycutt Lane in Franklin, which is located approximately 1 mile from the current hospital location. With CON approval, we are anticipating that the new facility will be constructed and accepting new patients in late 2022 or early 2023. This $45 million investment in a new state-of-the-art replacement hospital in Macon County is a reflection of Mission Health's strong commitment to the community and to the future of healthcare for the regions in which we serve. This new facility will ensure that we continue to provide effective and efficient care to our patients that is consistent with the most current best practices in quality and safety standards. Angel Medical Center has established a long-standing history of providing quality medical services to the community, as demonstrated through not only its Joint Commission accreditation, but also periodic, unannounced reviews by the Centers for Medicare and Medicaid Services. In addition, Angel Medical Center participates in several state and national quality reporting programs, including North Carolina Hospital Quality, Hospital Compare, and Health Grades. Mission Health System, of which Angel Medical Center is a valuable member, has had the distinction of being recognized for the 5th time in the last 6 years as one of the nation's top 15 health systems in the country by Truven Analytics in 2017. Mission Health is the only health system in North Carolina to achieve this recognition. Angel Medical Center will continue to have licensed acute care beds, operating rooms, a gastrointestinal endoscopy room, emergency department exam rooms, various imaging modalities, plus laboratory, pharmacy, physical therapy, and other ancillary and support services. Our project does not involve the development of any new services or acquisition of major medical equipment. Rather, the hospital will continue to provide the same general acute care services we currently offer. While we are not proposing to eliminate any acute care services, the proposed replacement hospital will be 25 acute beds in accordance with our critical access designation. This number will continue to support the projected need based on population growth, and it's reasonable and conservative when compared to the proposed 2018 state medical facilities plan. In closing, it is important to note that Angel Medical Center will continue as a critical access hospital, will meet the requirements to maintain its swing bed agreement, and acute care services will continue to be available to the residents. Thank you for allowing us to speak today.
Does that conclude the presentation by the applicants then? Is that it? Okay. All right, we've reached the public comment portion of the hearing, and I'll call the first name on the list is Warren Cabe.
Thank you. My name is Warren Cabe. I'm the Director of Emergency Services for Macon County. And the divisions that I oversee with the county are EMS, 911, Fire Services, and Emergency Management. And obviously, I can't speak on behalf of Macon County government, but as far as my department and myself, I can't stress enough how important it is for us to have a vital facility such as this in our community. A lot of counties are not lucky enough to have a medical facility. A lot of their transports are out of the county. And we're fortunate in Macon County, we have two. And if this is the plan to make this a productive and economically viable facility for years to come to serve our residents and our visitors, then we do support that plan. The location for us is not an issue. We are good with the location. It will actually probably facilitate our transports a little easier for our patients from the east, the south, and the west. And we support Mission and the issues that they've been working with. We've partnered with Mission on several different things, and we may not always agree philosophically, we may not always agree business-wise, but we've always had the ultimate goal of providing quality health care to our customers. And if this is the plan, then we support that.
Thank you. Todd Doster.
Good morning. My name's Todd Doster. I'm the coordinator for Macon County EMS, and just to echo what Warren said, we are supportive of the hospital and things that I'm kind of the day-to-day operations and the things that we encounter at the hospital. We talked about the room size there a minute ago, and sometimes statistics and percentages don't really make sense until you apply them. Many times when we go to move a patient from a room, we have to pretty much take everything out of the room before we can even get our stretcher in there to access them. So while some of the numbers are hard to kind of wrap in your mind, when you apply those in a realistic manner, it does kind of make sense. And also, when we're used to something, we don't really think about how inconvenient it is, and we just deal with it. But interacting with some of the other facilities who have expanded and have more of a nicer flow of their facilities, it does. You kind of realize the difference that it does make. And as far as the location, like Warren said, the access that we have where the hospital is now, I know is convenient for many things because there's other doctors' offices around there. But as far as the EMS access in the facility, we have to deal with the traffic in town, especially right now while the town bridge is under construction. In our transports, that sometimes, depending on the time of day, will add 5 to 10 minutes of the hassle of getting through town. So yes, there are some drawbacks to it because we're used to things the way they are now. However, that location that they're talking about putting will be much easier for us as far as EMS to get in there and access those patients. So again, just like Mr. Cabe said, we are supportive of the decision.
Thank you. Those were the only two names who had signed up for the public comment portion. But I'll just ask, are there any members of the public who hadn't signed up who would like to speak? All right. Well, if not, I'll ask if the applicant has any final closing comments or summary comments they would like to make.
I'm Dr. David Franklin. I'm the president of Mission Clinic that represents over 500 physicians and over 400 advanced practitioners that are dedicated to the care of the patients of Western North Carolina. Now, Bill Hathaway, our chief medical officer, was going to be here, and he's with family. He's got his brother-in-law has got a major medical illness, and we wish Bill and his whole family the best. Mission is very excited about this opportunity to propose a new hospital. Many of us sat through a lot of meetings in the board and facilities and leadership recognizing trying to renovate the existing hospital was not practical, and the opportunity to build a totally new facility not only made the most sense, but we thought it was the best for the community. And that $45 million commitment is our way of trying to extend the care to this community in the best way that we can. I have to echo all the comments that the previous speakers had shared, and I don't need to repeat them. The component of the emergency department, and I really appreciate our EMS colleagues commenting in a positive way for this proposal. We're going to expand the emergency room, which is critical in rural America. We're going to have more rooms. We're going to have specialty rooms, including behavioral health and isolation rooms. The hospital size, for all my nursing colleagues, a lot of us grew up in rooms with small beds and no one could be in it but the nurse and the patient. That's not the standard anymore, and we're going to have larger rooms that allow us to give better care, better technology, and also have better access for families to visit. Regarding the resources, Kathy Ayat went over all the things that we're committed to. We really do like this location because it's going to have great access, high visibility to the community, which will extend not to when people need health care, but when people are looking at Franklin to move to. The idea of, is it appropriate to replace the existing structure? This is fully consistent with the basic principles of the state health planning process. And the size of and capacity is completely aligned with the 2018 North Carolina health recommendations. So on behalf of Angel Medical Center and Mission Health, we respectfully request your approval to develop in order to better serve the local residents when they have acute care needs. And thank you for this opportunity. We eagerly await your approval.
All right. Well, I'd like to thank all the presenters and the folks who spoke during the public comment portion. And with that, I'll conclude or adjourn this public hearing. Thank you very much.